Welcome back to another episode of Sports Medicine on Tap. My name is Brandon O'Lyon. I'm sitting here at Neck of the Woods Brewing Company drinking a nice cold beer on a beautiful August day with two good friends, Dr. Frey and our good friend and returning guest, Dr. Bernardini. Gentlemen, how are we doing?
Excellent.
Amazing.
All is good. We're here. Football camp is in full swing for me now. It started. We're in football and then...
Tiny bit of Olympic withdrawal.
Yeah, a little bit.
Agree.
My son has now gotten accustomed to waking up. Olympics. I'm like, dude, it's like the one time, like, I got nothing for you, man.
Yeah.
Like,
Yeah.
You know what we do? We go back and watch the obscure sports that
Right. That's a
that
good move.
aren't highlighted on. And
Yeah.
that's actually pretty fun.
I know, for sure.
It's amazing the things that people commit their lives to.
Right.
Oh,
Yeah.
Seriously. My daughter was like, what are we going to do now? And
Yeah.
I'm like, I don't know.
You're gonna watch whitewater kayaking.
Yeah,
right?
that's
Just
what we're going to do.
randomly, like...
Yeah.
Which was pretty stinking cool the way
Yeah,
they
it
had
is
that set
pretty
up.
cool.
Right? They'd all drop
Yeah,
in and
yeah.
the whole course.
Yeah.
Yeah.
Clearly, I watched a little bit of it
Yeah, the
already.
kayak cross.
Yeah.
Very cool event.
I know.
Yeah.
I know.
Yeah, I actually was fortunate to watch the breakdancing competition.
Oh, no.
And
Those guys are
The
amazing.
Australian
woman.
woman?
So I watched
Oh,
the whole
God.
women's
Yeah,
competition,
yeah,
believe it or
yeah.
not, the dig. And
You did?
yeah, it was just
Wow.
on, and all day, me and my son were just watching. He thought it was so cool. He was putting his head on the floor, like doing it,
Nice.
trying to do his
Little
thing.
C-spine injury?
Yeah. He was getting all wild. But while it was happening, I was like, wow, this the woman from Australia who's gone viral on the internet.
Yeah.
Was just like, oh, she has a very interesting taste of this.
Technique,
and then,
yeah.
But
Yeah.
it's like my thing
She
was
kinda
it's
ruined
like
it all.
it kind of ruined it all a little bit just because
Yeah.
she's getting all this like negative viral publicity where it's like all these other athletes were doing so
I mean,
Yeah.
crazy things.
Amazing. Gymnasts, to music, like incredible,
Yeah,
right?
just spinning on, and it was
Yeah.
all like it was cool how it set up. It was just a DJ up there, and the dancers had no idea what was happening.
Right.
DJ was just mixing as he.
I didn't watch any of it.
and you had to
You didn't?
adapt to it.
And I was a
It was pretty
former
cool.
break dancer.
Oh man. Oh man.
We won't get into that.
Yeah. All right.
I
Well,
wouldn't try
unfortunately, it's not in the 2028 LA Olympics, so I don't.
I
Really?
heard, yeah,
You got
yeah.
rid of it?
It was already
Ah.
predetermined that it allegedly
One
wasn't going to
and
be
done.
one and
So,
done.
that's kind of
But
interesting.
there's a chance it comes back in 32, I guess, in the next one.
But flag's going to be in.
Yeah, flag football,
Yeah.
lacrosse,
Lacrosse. I love it.
Very
cricket.
interesting.
I think cricket's in.
That makes sense.
Seriously, it does.
Yeah.
Make
I didn't know
sense,
that, but
actually,
that makes
yeah.
sense.
There
That's
was another one, baseball. Baseball's in. I
What?
think, in LA.
I feel like
Honestly,
we're getting out of
it's about time.
control. a little
Like I
bit.
don't understand why it's not. Actually, is it?
It's going to
No,
be.
you think?
I don't know. That's interesting to me. I'm not sure how I feel about that. Although, you know what else is interesting? Did you guys see there's an organization that's doing something called the Enhanced Games?
Oh, I heard about that word.
I
There's
don't
no
know
drug
if I like
testing.
where that's going.
There's no drug testing.
Yeah.
There's nothing, right?
Well, they have to be managed by a physician,
Yeah.
and they can effectively use whatever the physician
Right, whatever they
Heads
prescribe.
exploding left and right.
possibly.
Oh
Just-
my god.
Just all jacked up and
Right,
all on
right.
PEDs.
Yeah.
Yeah,
Are
MLB in the early 2000s.
And they're gonna have
Sorry.
only so many sports. They're gonna have track, swimming, combat. I think MMA or
Oh, that's bad. Yeah.
and that which will be interesting. And there might have been a handful,
Wrestling?
a couple more. Maybe it was wrestling. Maybe it wasn't MMA.
Right.
But that was a big point of discussion because
I'm
then
guessing they're going to go MMA with that one.
maybe.
Yeah.
Yeah.
So it'll be interesting.
It's interesting.
The way things are going.
Well, it's like
Very
the
interesting.
two like opposite sides of what people say about the Olympics. Just generally, it's like they should do an Olympics of just like you just get almost like drafted like random average Joes. Like, oh, you're going to compete in the 400.
Yeah.
You're doing gymnastics or whatever.
Oh, that.
and
Right.
that entertainment would be
That would be interesting.
very
to watch.
entertaining.
Yeah.
And then the other side
That'd be
is
like the Australian
let 'em-
breakdancer.
pretty much.
Yeah.
Just let them take whatever they want. Let's see
Yeah.
how fast people can
Yeah.
actually run.
Wow. Yeah. Well, and this, so they have all these athletes that are saying I can beat, Usain Bolt's 100 meter record if you allow me to enhance.
That's what, yeah.
Which
I think
maybe-
world records may fall. I don't know if any of it will count. but
Well,
world
it
records
won't
may
count
fall
as far
like
as USADA, WADA. So
Yeah.
they won't be. I don't know what the right term is, but they won't be official, I guess.
Right, yeah. they're
China's
not-
going to have the exact same scores.
yeah. Yeah, they probably will.
Man.
It's interesting to see the medal counts.
Right?
Yeah.
Man, can they dive?
And that and all
Yeah.
diving and playing ping pong, like
Holy
table
cow.
tennis. Holy cow.
Shout out to the Washington Township resident who made the table tennis team.
Oh, really?
Yeah.
Yeah, I don't know who. We started
Wasn't
looking it up
aware.
one day, and then,
That's crazy.
Yeah.
Incredible.
Yeah. So-
I'll say, as I was watching, there are a ton of athletes from New Jersey, especially like track and field, over and over and over again that popping
Yeah.
up, and it's kind of cool, pretty
Yeah.
impressive.
Yeah.
We talk about it a lot on this show.
I know.
Wrestling's very
Oh, yeah,
big in the
dominant,
state.
for sure,
Yeah.
for sure.
Yeah.
okay performance. You know, a couple of guys. Spencer Lee made the finals, lost in the finals.
Yeah.
Dake from Cornell lost in the semis. Brooks lost in the semis.
Women perform well.
The women performed very well. Yeah. Agreed.
Women's soccer,
Women across the board.
What a
US.
show.
men's
Yeah.
soccer,
They actually
Morocco?
played well. I don't
Morocco.
know.
Morocco.
No, not bad. They had a good showing. I think it's unfair.
Okay.
They had a decent showing. But
No,
women's soccer looked great.
Yeah.
Women's basketball. What a game by
Yeah.
France, though, right?
Even
Holy
men's
cow.
basketball, Steph Curry just totally
Yeah,
took
that
out
was
France
amazing.
I know.
single-handedly in 3 minutes.
Yeah.
Right.
I was.
Crazy.
But they were pushed.
Yeah, they were at the end. It was a.
They got pushed a lot, the whole thing. It's just, and it was kind of cool. Like it was kind of like a little bit of a last showing of like this generation of all the greats, all the LeBron, Kevin
Gray
Durant.
beard.
Yeah. There's going to be a big turnover,
Yeah.
I think. You're right. You're
Yeah,
right.
I think next when we see him in LA, it's going to be a lot of younger guys.
Yeah.
You know, and how many guys got drafted in the first round from France this year? And they had a number of really good NBA players on their team this year.
It's
I
a
wonder
global.
if they're
It's
getting toppled next year.
It's a global
next,
pool of
next
athletes, really.
It really is. Yeah.
Yeah, I feel like historically, like Serbia's always good. I mean, they have Nikola Jokic.
Right.
He can carry anybody by himself. And
Yeah.
then Australia's
Australia's
always been really
good. Yeah.
And
A
then
few
France, and then the USA.
Russia has been competing, but traditionally they've had a pretty good team as well, right? Like one of the reasons why we were so, I don't want to say dominant because China was right there in the medal count, at least for gold. But one of the reasons we did so well, I think, is because Russia wasn't there this year.
Yeah.
Yeah.
You wonder. You wonder.
You wonder, yeah.
Yeah, you figure like
They're busy.
a little bit, right?
Yeah, they have things going
Bad
on.
situations.
So
Yeah.
that being said, right? So they're wrapping up Paris, and now the next shot we get to Olympics is going to be in LA in 2028.
Yeah.
Taking it to Hollywood.
Paralympics, very cool to watch.
Yeah. And
Take-
it'll be
take
in our
some
hometown, and it'll be in Hollywood, which brings us to our topic of the night, Hollywood Brown.
Nice segue.
You like that? I've been thinking about that all night.
Beautiful.
Uh,
That's great.
Thought about that last night when I was typing away.
Hollywood Brown.
So, like we mentioned, football's in full swing, and we get football injuries, and then we have Hollywood Brown from the Kansas City Chiefs, who injured his SC joint, had an SC joint dislocation in the preseason game. First play of the game, only play he's played in the Kansas City Chiefs jersey, catches the ball, gets tackled, and we talked about it before the show. It was a run-of-the-mill, average. It looked like an average tackle. It looks like something that happens all the time in football.
Yep.
Yeah.
Kind of pops up fine, and then next thing you know, the video clips to him just on the sideline, just kind of heaved over and just...
Yeah.
Tell us what that is.
So SC joint is a sternoclavicular joint. So it's basically the inside part of your collarbone, your clavicle, where it kind of connects with your sternum. It's a pretty strong joint. It's a rare injury. I think it's like 1 to 3% of shoulder girdle injuries, and the mechanisms are different for different injury patterns. So what we think is happening with him is that he had a posterior dislocation of the joint. So dislocation is where the joint slips out of alignment. And the bad part about one of the directions that it can go in is if it goes backwards, it goes into some very, very important structures that are potentially life-threatening.
Right.
Your trachea, your esophagus, some very big blood vessels, and all those things can be damaged and potentially fatal.
Big deal, right?
Big
We
deal.
were saying before we aired, during my residency, I spent 6 months at Children's Hospital Philadelphia, CHOP, and there's like one of the articles on this that like it's one of the things that we all read as residents. I think it was while they were intubating the patient to undergo surgery for this. They had a tube, they use like endoscopic.
Endoscope.
Yeah, and they put it down, and you see the trachea indented, like about half to 2/3 of it just closed off because it's indented from the outside, and that's the clavicle pushing up against the trachea, like scary stuff.
Yeah.
Big time.
Yeah. So, the other direction is anterior, which goes forward, and there's really not a lot of important stuff, that way it's not life-threatening. Those are not comfortable, definitely a high-energy injury, but those are fairly well tolerated. So the posterior dislocations are definitely the much more concerning of the two.
Yeah, and I think with that said, too, is like, this is rough numbers, but there was an article in the reading that the SC joint injuries are such a small, like you said, such a small percentage of shoulder injuries, and it's even a smaller percentage of when it goes posterior.
Yeah.
Oh, yeah.
It's like 1 to 9 or 9 to 1, like whatever. Usually
sounds
it goes
about
up
right.
front.
Yeah, yeah.
And then the rare times, so we're talking 5% of all football injuries, if you will, if you want to go that far, and then 10% of those go posteriorly. So
the
this
body,
is very rare.
Evolution's done a good job of designing us well, and that joint is protecting a lot of important stuff.
Right.
And so it's really strong. It takes a high level of energy. That's why this injury is kind of underwhelming when it comes to you wouldn't expect a guy who's in the prime of his career, strong, who's got a lot of muscle. probably really strong ligaments, joints to have this kind of injury. But
Odd.
it's just
Weird things happen.
it's
It
just
happens in football, right?
a
Like-
perfectly wrong mechanism, and here he is. So yeah, it sounds like they managed it right away.
Yeah, which is great news, right? Like
Yeah.
it wasn't missed, wasn't ignored, wasn't overlooked.
Right.
Yeah.
And to those means, right? Like so typically if it's anterior, in terms of somebody presenting either on the field or in the office a couple days later,
Yeah.
what is it you're going to feel, or what are you going to notice?
There'll be a big swelling, big obvious asymmetry, a big deformity in the clavicle on the side that's affected will be kind of very prominent on one
Right.
side, so it'll be coming out towards you.
Yeah.
And that's pretty obvious.
What if it's posterior?
Less obvious, but still there'll be a lot of soft tissue swelling and damage. But that swelling may actually balance out the appearance of that clavicle going back. So
True, right.
So a lot of times what you see with those people is, and I've seen one person and we treated him. And we'll talk about that later, but kind of coughing a lot, throat irritation. His voice was a little funny.
Right.
He's had some trouble swallowing. The other thing that I've never seen is if it's pushing on a big blood vessel, the blood
The
can't
vascular compromise, right?
return well, and you get what's called venous engorgement. So you get all these like big swollen blood vessels in your neck
right.
and in your arm, and the arm can swell and all these things. And those are all things that I think are important for athletic trainers, doctors, anybody who's doing any kind of sideline management to have a high index of suspicion for,
And
to be able to put all those things together.
Right.
And then a quick point about that, because a lot of the athletic trainers that theoretically are listening to the show, maybe on a high school or college setting, this is going back to our orthopedic days, right? Like the training, like it's the first bone, the clavicle is the first bone in the body to ossify, and the last bone in the body for the growth plates to fuse.
Yeah.
So it's actually
great
between the age,
point.
right?
Yeah.
Right, between the age of 20, 25 years old, where finally that medial clavicle physis, the growth plate in the medial, where we have this injury, fuses. So in this age group, sometimes it's not actually a dislocation. It's not an SE dislocation. It's a fracture. They break through the growth plate.
Yeah.
Yeah.
And they're hard to see on X-rays.
Very hard. Yeah, very hard to figure out and decipher on an X-ray.
Yeah, so there's
What,
a
do you
special
remember the
X-ray.
view?
Yeah, serendipity view.
Serendipity view. Yeah.
Yeah, and that can help you tell if it's an anterior or posterior subluxation or dislocation. But
Helps.
but the reality
Do you
is,
think it really works? Can you tell?
yeah.
I think I can sort of tell. I
Yeah,
get the CT every single
yeah.
time anyway.
Yeah, absolutely. I mean,
Right.
especially if the CT gives you much more information, and I think then you get to see some other structures there too,
Sure.
and how significant it is. But
Yeah.
and the CT, I think the serendipity view is only good for showing if it's asymmetric,
Yeah.
and if it's asymmetric anterior or posterior.
Yeah.
But the detail of whether it's a fracture or whether it's a dislocation,
It's really
or
hard to figure
what
out.
percentage, it's hard. So I think CAT scan is
So-
kind of the gold standard there.
So to decipher that or tease that away, get into the details on that, right? Serendipity view, typically it's an X-ray that's done at 40 degrees cephalic, so pointing, like instead of being straight at them, pointing towards the head, 40 degrees. And then if it's anterior, typically it'll look like the bone is on that side, the clavicle is. If it's it will be above or superior than
higher.
the other side.
Yeah.
And if it's posterior, it'll look like it's below the
Inferior.
clavicle on the
Yeah.
other side.
Yeah.
And I find that you just look for the asymmetry and I think it's anterior.
Yeah.
I think it's superior.
And it's funny, I saw a guy today, retired vet,
Yeah.
he's 70-something, who had an old anterior probable dislocation.
Right.
And now he's got arthritis. We got a serendipity view, and it's kind
You
of
can see
interesting.
it. Right,
yeah,
right.
that we had this planned for today.
wow.
And, yeah.
Look at that.
Talking about timing.
He's a lot tougher than Hollywood, though.
So speaking of Hollywood then, right, like who's the sort of the focus of our launching pad for this talk, right? We don't actually have his medical chart and his
Correct.
medical information, but we're just sort of speculating, using that to talk about this particular injury. But given the fact, we do know that he stayed in the hospital overnight.
Yeah.
Given the fact that he stayed in the hospital overnight, do we think his is anterior, posterior? What direction do you think his
I
went?
for sure think it was posterior. I don't think an anterior would gain anybody's.
Go home, buddy.
Get on a plane, see you, good luck, find your guy when you get home. Posterior is taken very seriously. Very often they'll monitor you for those signs and symptoms. So there could be delayed damage, there could be intimal damage to the vessels
Right.
where it doesn't present right away. Those can clot later. So, and he may have also required. I mean, my theory is that he probably
Like a closed
required
reduction?
a closed reduction, which basically means that without cutting the skin, usually under sedation because it's fairly uncomfortable, you can manipulate the arm in a way or the shoulder in a way that you can pop it back into place.
Have you seen any of these on the field?
No, actually, I haven't.
So
thankfully.
I was in the office with Mackenzie Wall today, one of our non-op sports docs,
Sure.
and she said that it was a requirement for them in their sideline coverage bag to have a towel clips to be able
No.
to. I swear to God.
To do it there on the sideline, you're poking
I'm
through the
telling you, that's
skin
what
with a
she told
towel
me.
clip. Like you're grabbing the bone.
You're
Really?
grabbing it.
Yeah.
Yeah. Well, if it's life-threatening, theoretically.
That
I
seems,
mean,
that makes sense.
that
If-
seems extreme.
Yeah.
Yeah, seriously?
Yeah. Yeah.
Holy cow.
Yeah.
That's
Okay.
pretty impressive.
I mean, that's
So, towel clips effectively are these really pointy kind of, these really pointy forceps kind of
Yeah.
that come to a head together and
Little
and-
grabbers.
Yeah, they grab and basically, literally, you could poke right through the skin, grab the bone, get a hold of it, and
Yeah.
pull it
and
back.
hopefully nothing else.
That's one of the techniques that you can use in the operating room.
Yeah, it's all
but the
traction on
the
the
other,
arms,
yeah,
yeah.
the other is, and what I've been involved with is, we had a big towel roll that we put between patient's
Always a
shoulder
good
blades.
idea. Right.
And so that causes the kind of the shoulders to be able
For
to drop
posterior,
back
not anterior?
for a posterior
Yeah.
dislocation. And effectively, you push on the outer third of the clavicle and the shoulder joint. And what that does is, as long as the clavicle is not fractured, it levers that inside part forward.
Yeah.
It pushes it forward.
YouTubers can see this one, right?
Yeah.
As you're doing it.
And what that does is it basically pops that forward if it's, not fractured and it's, one piece.
Did the towel clip in the bag on the field?
In the bag. Yeah.
Yeah.
I mean,
Did they have a tray or a crike tray in the bag, kind of a thing too? Like that's some big.
I've seen
stuff.
it. I mean, we don't have them. I don't think exactly the like advanced airways and stuff. Like, there's
Right.
a lot of invasive things that are on the sidelines that are
If you need to, yeah.
Like, oh man, that's,
Listen, it's controversial whether you should reduce joints on the field.
Right.
This is not something that is standard of care for sure.
Right.
I've never had a towel clip in my
Yeah.
possession to
Yeah.
cover a game.
But I guess someone's
I
dying in
imagine if
front of
somebody
you.
is dying in front of me, and I think
do
that's the
anything.
diagnosis, then I might be happy if I have a towel clip in my
Right.
back. The other reality is most games that we cover now have EMS
on site.
available
100 yards down the field.
100
Right,
yards
yeah.
down the field, and God forbid there's an issue with the airway, or there's things that can be done. But hey,
Yeah.
That's
right?
wild.
Contingency
I can't
planning.
believe she had and that it's all about contingency planning, right?
Emergency action plan.
Right.
Yep.
And it's something that it's going to happen so few times that if you're not ready at the time it happens, you're not getting a second try. You
Right,
just
because
need
I
to be
mean,
ready the
if you're
first time.
pushing on one of those important structures in the neck,
Right.
and you can have the ability to relieve that pressure and change something. I mean, sure, it could.
You're a hero.
Yeah,
You're a hero.
You're a hero.
Right.
Man, that sounds a little dicey.
We talked about Nate Holmes, right? Like with the
No, we don't.
no.
Hero and Nate Holmes, we should have at least a 5-minute break.
We'll be back. We're back.
Okay.
We're gonna be here.
All right, go ahead.
Speaking of a quick break, while we're just doing it,
Oh,
Well
nice.
said, well played.
See, I blocked it.
you need a quick block. We just want to give a quick shout out to our sponsors at Virtual Orthopedics and Spine. From runners' knee to dog walkers, hip to yard work, back and laptop wrist, they have a doc for that. Find the right specialist for you at virtual.org/ortho.
What were we talking about?
Towel clips.
Towel clips.
Contingency planning. Nate Holmes, you were going to tell a story about Nate.
Catcher's catcher and
Yeah.
gets hit in the
Commotio
chest.
cordis.
Yeah, commotio cordis. But he's ready to go, right? Like if you're not ready to go, you don't know what it is, you don't recognize it. Like you got one shot and Nate
Yeah.
saved the kid's life.
Yeah.
And yeah. So I get it. Like be ready for kind of everything you can be ready for.
It's like those things that you like you said, you plan for it and you hope you never happen. And then when it happens, you're like, oh man, it's happening.
Yeah.
Right.
Like I've witnessed, one of the craziest things I've ever witnessed was a track and field official getting hit in the neck with a javelin.
Holy cow.
What?
Really?
Yeah. Live in person. So
That's horrible.
one of the craziest things I've ever seen in my life.
Impaled him?
It stabbed him. It didn't impale him. But it went in.
Is there a difference?
It just wasn't stuck in him when I got to him.
Oh my gosh.
That's
Yeah.
incredible.
Yeah.
Did he live?
Unfortunately, no, from secondary issues.
Oh God. Holy cow.
like infection or something?
Yeah, infection
Yeah.
pneumonia.
Oh my god.
That's unreal.
Yeah.
You know, did you see those little cars that drive the javelins back at the Olympics?
No, I missed
Yeah.
it.
Oh, no.
Actually.
Yeah. They look like little. What's the stay in the car, Frank car?
That little car.
It's like a Pinto. Not a Pinto. What do they call those?
Golf carts.
It looks like
not a station wagon.
No, that looks like a Pinto.
no.
Is that a
It's
Pinto?
like a Pinto.
It looks like they looked like miniature Pintos, and they would basically put the javelin in it, and they would send it back so that nobody was throwing javelins back towards. I imagine.
Yeah, just throw it back there.
Yeah.
Yeah, it was one of the craziest
Wow.
things ever.
That's
It
unreal.
was, but to what I was going with was like, with our students and stuff, like I always talk about, like we play the game, worst case scenario, what's going to happen? And I mean, like a half hour before it happened, we talked about it. I was like, we were covering field events, and it was like the worst thing that could happen is this.
Yeah.
And
It
30 minutes
actually
later, 5 minutes after we handed out a Band-Aid, I was like, that's the first thing we did all day. And then I watched the whole thing happen. It was right there.
That's got to be
Unreal.
disturbing.
Very.
It was weird. It was definitely an odd one. But one of the fastest and most quickest time of injury to on an ambulance off the field within 10 minutes. It was
I'm
crazy,
really glad.
crazy
like,
fast.
That's incredible.
Track and field.
Right.
Yeah.
Wow.
My chief resident at one point would, like, while you're scrubbing in the scrub sink, and nowadays, like, you only scrub for one case, and then after that you're like using the gel.
Yeah.
We're scrubbing at the scrub sink, and that usually gives you 7 minutes or so to sit there and chat and talk. And he would always ask you, look at it, what is the worst thing that you could do in this case?
In this surgery?
Yeah, and he looked.
That's the way to
you
start.
Think through it. Yeah, I know. But he was
No, you're right.
preparing
It's
for
good.
disaster.
Yeah.
Right.
And then you give him an answer, and he's like, "Don't do that." And that's what he would say. Well, don't do
Simple,
that.
right?
Yeah, like this is the worst thing you can do. Keep it on your mind. Don't let that happen.
Yeah.
But to go back to our topic tonight with Hollywood Brown, right? So, like we mentioned, he was fixed without surgery. Andy Reid was like, yeah, they got it back in place without surgery, nothing.
Yeah.
Which probably means this closed reduction technique
Yeah.
was done.
Yeah.
Right.
That's really the only way to do it.
And I think
It's just they didn't have to cut the skin.
right.
Yeah.
And we mentioned that we really haven't covered this injury on the show before.
Right.
And I think, ironically, for Kansas City Chiefs, it's not their first time seeing this. With their former star Tyreek Hill has a similar injury in 2019.
Right.
Missed about 4 weeks. The question here is, how long is Hollywood Brown out? There was a report that came out he's out about 4 to 6 weeks.
Yeah.
So I was curious to see, is he going to be on the 4 weekend or the 6 weekend?
So I want to. There's 2 points I want to cover before we address that question. So 2 quick things. Someone has an injury, they have pain there, you're not really sure what's going on. Dyspnea or dysphagia, 2 different things, right? Like shortness of breath or inability to swallow, difficulty swallowing, right? Or even they come in the next day and like it really hurts and like I can't, like I feel like food's getting stuck. That's this injury until proven otherwise, right?
Absolutely,
So two, and again, just like we were talking about,
Yeah, they'd be hurting over
the
that
clavicle goes
spot.
back,
Yeah.
pushes up against the trachea, pushes up against the esophagus, and you have this particular issue. But now, yeah. I read that, and number one, I read, I'm reading that Tyreek Hill had the injury and he was back in 4 weeks, and then like you said, they announced maybe 4 to 6 weeks. I gotta tell you, I was surprised. That was fast.
So anterior
As far as I can-
dislocations,
What?
I think potentially could get back in that period of time.
Right. A lot less at stake.
Yeah, because less at stake, right? So the worst that could happen is it happens again, it gets worse, it's painful, it's not life-threatening, right? But posterior dislocations, guy stays overnight in the hospital, potentially has a reduction.
Right.
That means there's ligament compromise,
Yeah.
severe enough that he's got an unstable clavicle that could put him in a life-threatening condition. I don't think he's getting back any earlier than 6 weeks minimum.
Yeah, that's
that's
what I
because
would
that's
say.
kind of ligament healing time.
Yeah.
And they could throw all the science they want at him. The reality is biology's biology, and they could probably inject them with this, that, and the other, and but the reality is
And I
time to
think
heal.
Generally, it's kind of hard to like stabilize that joint through rehab, right? Like you're
Yeah, it just
strengthening the
needs its
structure,
time.
sure.
Yeah, you're just trying to
It's
minimize
like- it's not the
deconditioning in the
same,
girdle,
right.
keep range of motion, make sure that scar tissue isn't limiting anything. But the reality is, it just needs the time it needs to heal. I think.
Before you go
It's
running
very-
other people and get hit
Yeah,
again, right?
right.
Like,
Yeah.
So I'll say, actually, I think in my mind it's a little bit odd. Like the traditional teaching is Valpo dressing or Valpo bandage for 6 weeks, right? So that's I know. So Brad shake. So that's this big like A-strap, huge monster of a contraption keeping your arm like this right in front of you, and you're supposed to be in that for like 3 to 6 weeks. And number one, like I'm surprised because I feel like that compresses it. I would think just do a sling, just put them in a sling, right?
Or a figure of eight.
Or a figure of 8, pull it back. Yeah, absolutely, kind of butterfly figure of
clavicle
8.
brace kind of
Right,
deal.
yeah,
Yeah.
right.
That's like basically holding you in that reduction position.
So the idea like that you're supposed to be braced for 6 weeks, but instead you're actually getting on the football field. I don't know. It just seems.
I think the devil's in the
fast.
details of the injury,
Right.
right?
Yeah, we'll see.
But
We'll see.
I think I think Tyreek Hill did not have a posterior disc. Do we know?
I don't know. Do you want to type
I
Canada?
didn't see anything. I just saw that it was.
Do you think Hollywood will get faster? Like, will he run like Tyreek Hill after this injury?
Right? Is
I'm
that a
pretty
thing?
sure he's almost as fast as it is. He's a pretty fast guy. No?
Tyreek?
Tyreek said he was going to be he's Noah Lyles.
Yeah, he's going to raise Noah Lyles, right? Yeah.
And the truth is, he might win, man. That dude is fast.
If Noah Lyles has COVID when they race.
Oh, man. He didn't look good after that, the 200.
Yeah.
Well, yeah, if you talk that much about how great you are and then you lose, nobody looks that good.
Interesting.
Right?
He looked pretty good before the race.
Yeah.
Jumping around.
Bouncing around.
Yeah. So
Interesting.
I'm not sure that was all physical.
Interesting.
Yeah, that's my feeling.
Okay. All right. Put it out there.
That's it. I'll say that.
Moving along. Did you see? And we talked about it last week too. I'm just so blown away by it. Did you see the female cyclist, Kristen Faulkner, who
the one who just picked it up? The one who just picked up the event.
That's right.
Are we talking about Velodrome or are we talking about road race?
Road race. Yeah. And won gold. And wasn't even supposed to be in the race. And dominated. Like Lance Armstrong.
So Taylor Knibb, Taylor Knibb, who is a triathlete but also primarily a cyclist, gave up her spot so that she could be in the mixed triathlon.
Right.
And in the mixed triathlon, she came back.
Bacteria.
First at one point, and then was past the finish line because she's not a runner. She's really a cyclist.
Oh, is that right?
And yeah, Olympic triathlon is super competitive in the run, and they're always right. It's almost always a sprint finish between the top three.
Yeah.
And but yeah, she did really well. I mean, she got us a medal in the mixed triathlon, which is a pretty interesting race. Yeah, the Seine.
Yeah. In the Seine. Yeah. Exactly.
So I at one point did the Philadelphia triathlon, and it was a similar high bacterial warning count, and they're like borderline, let them race.
They'll be all right.
Yeah.
You're tough enough.
I'm okay.
Yeah.
You made it, right?
Yeah. I did have long hair before the race, though.
That kept all the bacteria out.
Yeah. But now it's all gone.
No, it's okay. I do. I haven't done the Philly Tri, and it has been on the list because the idea of swimming in the Schuylkill, as unappealing as it is, does sound like fun.
The second year I went to do it, they postponed it because they found a body.
You're kidding me.
I swear.
Bad timing.
Yeah.
Let's, not to go with bodies in the water, whatever. There was, I think, an athlete who just passed away from the CrossFit Games in the water. He had some.
I heard
something. I didn't look up into.
There's actually
we should
on YouTube. You see him just go under.
You know what? We should.
This bad stuff.
We should get a sports cardiologist on and talk about that. So
that's a really good point.
There's a really specific thing that, and I don't want to get too far off topic, but there's a really specific thing that happens to triathletes. Well, I guess it's not just triathletes, but I see a lot because I'm
heavily into it.
Where effectively there's no cardiac history, there's no cardiac risk factors. They don't have blockages, and effectively the way I understand it is, and they're doing studies on this with USAT Triathlon, there's a competing input from your sympathetic nervous system and your parasympathetic nervous system when you put your face in the water and you're amped up at the beginning of a race. And they basically, I don't want to say cancel each other out, but they compete with each other, and the heart and the signals that
Shorts
give
out the circuit.
and the cardiac arrest and dead.
Right.
Sudden death in the water. It's not an uncommon thing relatively. It's not. It happens every race.
Right.
So that's a really kind of interesting, unique thing. And we talk about what's the worst that could happen.
Right.
We've covered. I used to cover some of these triathlon events. We did. When the Challenge, which was like the Ironman competitor from Europe, came over to Atlantic City, we did some race coverage for that. And those are all the things that we were potentially talked about and prepared for. But and now you got this athlete in the water. I mean, that's a mess. But
that's a tough situation.
Anyway, I know we're not talking about that today.
Yeah, going off target.
Yeah, so I think it'll be interesting to see what happens here, right?
Yeah.
Right. And then something I did want to talk about, it'll be a quick cover, but I found it interesting when I was looking up different articles. I usually go to the basic ones, Sports Illustrated, ESPN, or whatever. But ESPN was like, Hollywood Brown dislocated his shoulder. And I was like, this looks interesting, and then we can dive into it a little bit. It's like, there's a difference.
Swing and a miss, yeah.
Swing and a miss. Like,
very, very different.
And then I was like, wait a minute. Because I think I texted you right after. I was like, we're doing this, right? We're talking about this tonight.
Yeah.
And then I went through some other articles, and I was like, oh, wait a minute. ESPN, I think, just missed it on this one. They just he dislocated something close to his shoulder, but he didn't dislocate his shoulder.
They need to consult Sports Medicine on Tap before they publish their
They
next
need to give us a
article.
call.
They ought to.
We'll
They
give them
ought
the
to.
anatomically correct diagnosis.
That's right.
To be complete, do you want to talk about surgical treatment for this?
Man. So first, I want to make a big. We need to distinguish between atraumatic. This happens to sometimes, especially the anterior version. I don't know if it ever happens posterior, but the anterior version, like for no reason, like all of a sudden, like you just wake up and it's kind of sticking out the front, and it's a little bit uncomfortable. And the right answer is leave it alone.
Yeah.
And sometimes it pops back in, and sometimes it doesn't. Right. And chronic ones. So I think they're defined as really more than 3 weeks. Essentially, if it's been out for like 3 weeks, leave it. Hopefully, it pops back in on its own. Sometimes it does, but leave it. What we worry about for the posterior ones, for the anterior ones, it's just the chances of it staying in are pretty low. It usually pops back out after that point. For the posterior ones, you worry about much worse things if it's scarring down to some of those other big things that we talk about. And like, when we go through training as residents, one of the things that we're always taught is if you're doing this, and there's actually a paper out now that says like that might have been overkill. But if you're doing this, if you're reducing these, even the acute ones that go posterior, you're supposed to have a cardiothoracic surgeon essentially standing at the not quite, but they would say standing at the door,
Be
ready to come
vascular
in.
surgeon. On site, ready
Right,
to go.
right.
Yeah. Because
But
if something bad, look, you got minutes.
You don't have a lot of time.
Yeah.
Yeah,
No,
it's
right.
a big deal, right? And but then so from a surgical standpoint, if you are doing the surgery, like so you try to reduce it, you get to it, 3 days after it's happened, and you try to reduce it, and it just keeps popping right back out. Now you're kind of stuck. And there are some, I think, for the anterior one that would argue just leave it, right?
Yeah.
But there are especially for the posterior one, and there may be some that would argue for the anterior one. There's a surgery you can do to try to keep it in, and typically what you can do is you're going to take a tendon graft. You can go auto or your own or from a cadaver, and you do little drill holes in the sternum and in the clavicle, and you have to weave it through like kind of a figure of 8 right over the top and try to sew it all together to reconstruct basically the check rein or to block that bone from being able to slide back out of the joint.
Yeah.
Something I've done 0 times in my life.
Agree. Yeah, I've never done that. Never seen it done.
Yeah.
I, to be honest, wouldn't do it if it came in.
I don't think I would either.
I think there's probably people who have had, just unique opportunity in their training where they've just come across it. They've seen it. They've done it. They just were they just happen to be in the right place, right time to see that, and maybe got a little experience, which is more than 99.9% of orthopedic surgeons have.
It's really
even shoulder specialists,
Even so.
Sports shoulders,
Before I came over here tonight, I was talking to my boss. We always kind of shoot it up a little bit of what we're talking about topic wise, and she was saying that she's only seen one of these, and the mechanism was interesting. It was a very large football player, and he went to go do a frog jump, a broad jump, and when the swing of his arms popped his SC joint out.
So weird.
Just right? And most of the times where I think a lot of the articles too I read tonight or last night rather.
Motor vehicle
accidents like
you see it from high energy trauma all the time.
And that makes sense.
And that was the one that I saw. It wasn't a sports injury. It was a trauma.
It's usually trauma. We talk about it because it happened in an athlete, but it's usually trauma.
Yeah.
And I mean that goes to say something, right? At this table, I think collectively we have over 50 years of experience. Give or take.
Brad has like 50 alone.
And with that, we have like
Almost.
1 or 2 cases that we've kind of seen. You know what I mean? So that just goes to show you the rarity of this and also how serious it is when it does get posterior.
The other thing sometimes is that if you have a chronic case, that bone can block the reduction. So there are times where you'll do a resection of part of the clavicle, remove that, and to try to allow that bone to kind of line back up and then do a reconstruction. Those have a higher failure rate. They're a little bit more complicated.
Very clearly,
and again, something that you have to be. What's the worst thing that could happen here? I could drill through a giant vessel, or the trachea or the esophagus behind this bone that I'm drilling holes in, and this patient could die very quickly.
Right there. Yeah.
So I would personally not even think about doing something like this without having a vascular surgeon scrubbed in with me,
right there,
with all his stuff.
Ready to
go.
Yeah,
right.
I mean, because it's such a rare event that it's you're not wasting anybody's time to cover your butt. I mean, it's
not like
once every 20 years.
And I mean, it's not like there's SC joint replacement or surgeons are specialized in this because it doesn't happen that much.
There may be
Right.
like somebody in
Like a
some point in the
thoracic outlet guy
country,
who also does this?
where they just happen to be like a niche guy
Right.
at a high level academic center where
Right.
everybody in the country is
Who works
referring
4
to
days
that
a
person.
year.
Yeah, yeah, and I would have to find that person.
And he probably works around the holidays where
Yeah.
car accidents
Yeah.
are at their highest
Right.
rates, and
Yeah.
he's in the big busy cities or
it's-
whatever the case
yeah,
is, right? Like
so, not us.
I wonder if anyone's hiring for that job.
Yeah, no.
SC joint,
Why are you looking?
No, it's a long shot.
a reconstructive specialist.
Yeah,
Be interesting.
Not anymore. Not anymore.
good.
So I think we're generally all in agreement that it's probably going to be on the latter end of that 4 to 6 week window that he comes back, and then
Yeah,
I would think so. I wouldn't have guessed Tyreek Hill would have come back in 4 weeks, even with the anterior one, to be honest with you. But he did. So maybe we get surprised. But if put a gun to my head and say, give me an answer, I actually think it's going to be a little more than 6 weeks. But
I do too. Yeah, I agree.
yeah. I think I venture to agree.
In general, small, fast wide receivers are the toughest of all football players. So
Yeah. All right.
Well,
I mean, it's a reason that they've been able to maintain and there has to be certain toughness built in to be able to be successful.
that and the good thing they're fast. They run away from
Right.
people and don't get hit.
that's perfect.
Simple equation.
Especially at like Bucknell and stuff.
Yeah, that's exactly right. I
That's what they
agree.
breed all the good ones,
I
right?
agree.
The toughest.
So I don't know. Where else do you guys want to go with this? I think we kind of covered a little bit of everything.
I think that was a good
Well,
review.
who
I think
else covers everything?
The takeaway. Oh,
Who else has you covered for everything? Virtual Orthopedics and Spine they have you covered from runner's knee to dog walker's hip. And guess what? They have a doc for that. Yard work back and laptop wrist. They also have a doc for that too. Virtual Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtual.org/ortho.
wow. I think the takeaway from my perspective would be recognize the injury, have a kind of a high suspicion
Yeah.
for a posterior dislocation. Don't blow it off.
Yeah.
Think about breathing issues, swallowing issues, and venous engorgement, and if there's any suspicion at all, like
Go to
ER,
the ER.
ASAP,
Yeah.
and potentially, to be honest, put them in the ambulance.
I agree.
Because
Yeah,
they
for
could
sure.
they could decompensate pretty quickly
Right,
if they're
like
in there.
things could go-
If it's
And I mean, God forbid, like they cough or something. It's
Yeah.
There's like another just jerky
Yeah.
motion or something that does causes some issue.
Yeah, and the other takeaway would be the point that you brought up about, in kids or people under 20-25,
Right.
it may be a fracture.
Right.
And
That's a
there's
fracture.
also, sometimes those have to be fixed.
Right.
Yeah,
And then
so treat it slightly different, yeah.
Within that regard, too, the fracture, you're going to have some jagged edges and some more
Yeah.
things that could
Yeah,
cut
I mean,
and some
yeah,
other things
yeah.
like that. And I think the importance of tonight's show is that it's also what's called the NCAA killing season, if you guys have ever heard that term. It's typically the first 2 weeks of August or so, give or take, because it's the first week that all college sports
Yeah.
are back, and this is when most of those catastrophic injuries kind of happen.
Yeah.
Granted, more or less
I've
the
not
heat,
heard that term.
heat exertion and other things like that.
You
But-
worry about that, yeah.
But it's just that time of year now. Like it's August. Most
Stuff happens.
Most sports are back in swing.
Yeah.
Preseason's going. Football's back. I mean, NFL
Yeah.
obviously starts a lot earlier than most college places, but everyone's in full swing now, where all those injuries really,
Yeah.
the catastrophic stuff happens.
Catastrophic stuff happens. And also, I used to call this the culling season.
Mm-hmm.
Like, this would be when, you're going to see those kids who didn't prep or athletes
Mm-hmm.
who didn't prep. They're not fit. They're not ready. And, they're popping ACLs. They're having injuries.
Mm-hmm.
They're banging stuff up. And then the ones that make it through this first month, 6 weeks, generally are the ones that are going to be on the team for the rest of the year and be the players.
Yeah.
The rubber meets the road. You can't hide if you didn't prep.
Yeah.
No, 100%. And then you get it I've seen it multiple times every time we do preseason camp. It's just like you said.
Yeah.
You definitely didn't train that
Yeah,
well.
you didn't train. You're not
Or
ready.
you see the guys who say come back from some kind of injury and they focus so much on X and they miss Y.
That
and
does happen.
That goes out.
Unfortunately, you see that happen all the time.
And I mean, we've talked about it recently of all the numbers of just how likely you are to re-tear your other ACL or other things like that. Just all those things kind of happen,
Right.
especially with the reintroduction of a lot of activity on
Yeah.
back-to-back days.
Yeah.
And, all that stuff.
Hate to see that.
Yeah, for sure.
Yeah.
For sure.
Busy time.
Yeah.
This is what it all kind of comes down to.
A good topic. Like we don't, it's,
Yeah.
it's not frequent. At this point, we've done so many of these shows. It's not often that
Yeah.
we get this like a topic. Like as soon as I saw it, I was sent you the text. Like,
Oh, yeah.
boom, we have our topic for the week.
It's like splenic lacerations.
right, which we already covered actually.
Right.
We
No,
did.
But
yeah.
it's not common that you get one of these like weird ones that
Well,
that are a big deal and really like they are part of sports medicine.
Right, and I
we
mean-
haven't covered it yet.
And the last time a high-profile athlete has had this is 2019. At least
Predated us a little bit.
Yeah, predated the show, and that's 5 years ago, right? So it's like You only get one of these a handful of times, once every couple of years. You probably see someone on a high. I'm sure it happens. I'm sure there's a bunch of other people who had a SC joint dislocation last week, but
not on a Kansas City Chief.
Not on a Kansas City Chief wide receiver or someone in the NFL.
As long as my man Pacheco's okay, we're good.
Yeah. Rutgers.
Right. Vineland.
Vineland. Yeah, I get it. Yeah, for sure.
Vineland alum there.
That's right.
So I think we're going to go ahead and close out our tab here and give a quick shout out to our other sponsors here, Neck of the Woods Brewing Company, serving us up the best beer in South Jersey, and Timber Reel Production, helping us get all this audio and video out to all our listeners. So give us a like and follow on YouTube and Instagram, and we'll see everyone next time. Thank you.